So I'm feeling very peaceful about the surgery, very calm, no second thoughts. Welcome to today's video. I'm going to take y'all along my entire surgery process. Today is the night before surgery. My mother-in-law just got here. She's going to be helping me with the babies and going to be helping me post-op up until the 8th because I will be picking up my mom at the airport. So she's going to be helping me from the 8th through the 13th. So in total, I'll have an entire week of help, which is I'm so grateful for because it's a lot of work. I'm in my closet because I need to pack like a little day bag. I will be able to go home the same day, so I'm not packing much. I'm going to pack the outfit that I'm going to go home in, and they said to pack something comfy. So I bought this cotton jumpsuit, which is really stretchy because I don't want anything pressing on my stomach because that's where my incisions are going to be. I'm packing an extra underwear because I don't want to come back in the same underwear, socks, tripod, and a battery because I do plan on filming. Some offices or doctor's offices, they don't let you film, so I'm gonna see what I can do, but I really do plan on filming the process for y'all so y'all can see. Earphones, a book, my phone charger, chapstick, and my wallet. So I didn't tell y'all what I'm having. My procedure is called tubal ligation surgery. This procedure is recommended to women who are 100%, more like 150% sure that you no longer want to have children, because what they do is they go in there and they clip you. So the only way you will be able to have kids if you suddenly change your mind is through IVF. But in my heart, I know that Emiliano is going to be our last baby. So I'm feeling very peaceful about the surgery, very calm, no second thought. I could have done it when I had him via C-section, but back then I wasn't sure. They kind of just like abruptly say, oh, do you want me to tie your tubes while we're in there? And I'm like, whoa, I didn't even get a chance to think about it. So I got a chance to think about it, and not that Emiliano's a hard baby, because he's not. He's literally an angel. I would love to have more babies, but the thought of having twins again kind of scares me, because what if I get pregnant and have another set of twins? Now I have 5 kids. So 3 is our lucky number, and I'm so grateful that God has given me 3 babies. I feel that our family is perfect. So I'll see y'all tomorrow in the morning. Okay, I'm all checked in. They gave me some medication for nausea, pain. Got my little garment and hat, some mesh panties, socks. I have to wipe my body down, and then I have to give a urine sample to make sure I'm not pregnant. I can't really record in here, but I wanted to give y'all an update. It is maybe like 10:15. I'm waiting on the anesthesiologist. I was supposed to start the procedure at 9:30 apparently, but I've just been relaxing, honestly. I took an hour nap. I'm feeling very peaceful, no anxiety. I called my mom and we prayed a little bit. I'm texting my family and just keeping everyone updated. I just FaceTimed the girls and the baby. They're with my mother-in-law. They obviously don't know exactly what I'm doing, but I just told them I went to the doctor's appointment and mommy's gonna have an owie. I don't want to get caught filming. So I just wanted to give y'all an update, and yeah, I'll see you guys after. I wanted to show y'all my incisions. This is my high-waisted pregnancy underwear. Trust me, you will need high-waisted underwear. You don't want nothing too tight on your belly. This is my stomach right now with my 3 incisions. They had to blow up my stomach to do the procedure, so that's why it looks bloated. They did little incisions here. He told me it was as long as your fingernail, and I guess it gets smaller. Pain-wise, it's tolerable. I went to sleep last night. I took ibuprofen, slept on the couch because the twins still come to our room. in the middle of the night, so I didn't want anyone to kick me, and I'm walking funny. Well, let me give a demonstration of how I'm walking. I'm just walking like this. Is that a good demonstration? Like, I can't bend forward. My mother-in-law's in town, Still's in town, very grateful for her, so she's helping me like pick up the baby, putting him in the high chair, putting him to sleep. I've been resting a lot in bed, reading, sleeping, napping. If you plan on doing this procedure, please get some help so you can have help for at least a couple days, maybe a week the most. And yeah, that's 1 day post-op. Hey y'all, it's 2 days post-op, and day 2 has been a lot harder than day 1. Day 1 I'd experienced little to no pain. Day 2 I feel worse. I'm probably like at a 70% right now out of 100. I'm having soreness in my abdominal area. I'm having a shortness of breath, and it's very hard to breathe right now. But that was one of the side effects that the nurse told me about. She said the side effects would be a tightness in your chest, dry throat, and shoulder pain, which sucks. But they gave me this little breathing exercise thing. I don't know where it is. I think it's in the living room, and I have not been doing that, so I think that's why I'm also experiencing shortness of breath, because I haven't been doing the exercise. Last night I went to sleep like around 9 and I couldn't breathe correctly, and I started crying. I had shortness of breath. I couldn't get comfortable. I would sit up, lay on my side, lay on my other side, and nothing was really helping. So I just fell asleep sitting up. Fell asleep maybe around midnight. Woke up at 3 because one of my daughters came to our bed, and I actually slept in my bed like far away from her. But yeah, I didn't sleep very good. So today is going to be lots of resting, lots of naps. Day 2 post-op. Hey y'all, it is day 3, whoa, post-op, and no, I'm not supposed to be driving, but I'm on my way to pick up my mom from the airport because my mother-in-law left this morning-ish, well, afternoon-ish, and I still need help because last night I went to the ER around 6 o'clock. I felt this tightness in my chest, and I was having difficulty breathing, and it got so scary because I couldn't lay down again. At first I was like, okay, this might be tolerable, I can, you know, I can handle it. But yesterday I couldn't. So I went to the ER around 6 o'clock, and they did chest x-ray. What they found was a tiny collapsed lung on like the left side, which was scary. So they monitored my breathing. They did a CT scan, and that was all normal, and that was to determine if I had any blood clots from the surgery, which was also scary because I like immediately threw up after the CT scan. I was at the ER maybe for like 4 hours, a very long time. Before I was discharged, they gave me some pain medication, and I fell asleep maybe like around 11, woke up at 6, and slept the whole night, which was amazing. Day 3 post-op, I'm feeling so much better. My incisions pads fell off in the shower. Well, they didn't completely fall off in the shower. I was able to peel it off without it hurting my skin or without me like doing any effort. So I just took it off. Mami, póngase aquí enfrente.
Espérate, la maleta.
This is the spirometer I was telling you about, the breathing exercise tool that I needed to do post-op day 1 and 2 that low-key led me to the ER because I didn't do it. I'm supposed to do it 10 times every single hour. So I set up my alarm because that ER visit was terrifying. I am, what is today? Oh, I lost track. 5 days post-op today, and I'm feeling way better. And when I say way better, I mean 85%, which is better than the last couple of days because I'm able to do more things, but I'm still not able to pick up my baby. Like, I can't put him to sleep, or I can't go upstairs, or I can't put him in his high chair. So my mom is definitely helping me with that, and I'm so thankful for the help because I don't know what I would do. Like, my husband works, you know? I have 3 incisions. One underneath my belly button going vertical and then 2 going horizontal, and they're not that big. He was right. It is as long as your fingernail. So in the picture you saw that it was kind of peeling. That was like topical glue, and they said that that's gonna come off by itself in the shower, and I'm not gonna peel it off because I don't want to accidentally rip out something or make my incision worse. So I'm just like letting it be. I'm still bloated from the procedure because remember I said that in order for them to complete the procedure or do the procedure, they had to like expand my stomach. I remember he said that that's going to take time to like debloat or whatever, but I don't care right now. I am just trying to heal and not make anything worse. I'm still so sad that I can't go to the gym, y'all. Like, if you know me, if you follow me on Instagram, you know I'm at the gym at like 5 something in the morning. So that piece of me or that piece of routine, it's like killing me because you'd have no idea how much that helps my mental health. But you know, I'm trying to follow the rules. I'm trying to get better. And the doctor told me I should wait 2 weeks, but he will tell me again after my follow-up visit, which is on the 13th. And I'm so excited for him to tell me because I'm like, hurry up. Is it 2 weeks? Is it 3 weeks? Is it 4 weeks? But I want to properly heal. Like, I don't want to rush into things. I remember with my C-section, I waited 8 weeks to work out, and that was the best decision I could ever do because I was fully healed and I felt fully healed. So yeah, y'all. Day 5 post-op, I'm feeling better, but I'm still taking it easy. Hey y'all, today is officially 9 days post-op. And yes, it is 9 days post-op because I dropped my mom off yesterday at the airport. I dropped her off after I left my 8 days post-op follow-up appointment with my doctor. And he basically said that my incisions look great. I'm healing properly. I can start working out within 2 weeks. I'm like, ugh, it's a long time. I'm counting down the days, literally like Xing out the days in my calendar. So yeah, everything looks good and I'm excited. I feel 99% healed because I can move more, I could do more. I'm just trying to not lift so much. So I'm getting a bag ready because I have an appointment today and I decided to get a little dress. I'm in my cowgirl era, so I'm wearing my tall red cowgirl boots with this long dress. I'm going to close the video here because I am not trying to be late for my appointment, and I am taking ointment scar treatment recommendations. So if you do have a really good one, please comment down below because like I'm on the search for one. Thank you so much for watching. I'm feeling better. I hope you enjoyed this video and I'll see you on my next one. Bye.